This video will go over some of the areas that weren't covered regarding weight management. In particular, the last bits on behaviors for weight loss and the information on weight gain and eating disorders. So we did talk already about the nutrition pillar, the exercise pillar, and the behavior pillar. And remember that everything you do needs to be sustainable. In other words, it's something that you want to change for the rest of your life. I think that it's important in terms of behavior changes that you keep track of not only what you're eating, but also what your thoughts were before, perhaps, and after eating. So these kinds of journals are more dynamic, so that you would have a column for what you ate and when, and then another column for what you were thinking or what were your cues to eat or perhaps overeat. And over time that allows you to see patterns, but it also allows you to have a little bit more control about why you're eating. We talked about calorie levels for weight loss, and you have three options. The first is to go by the Choose My Plate guide that you all printed out for yourselves, or use the calculator that we did a few weeks ago. Or if you wanted to start with a quick formula for weight loss, men would be 13 to 15 calories per pound, and women would start around 10 to 12 calories per pound. The key is not to drop your calories so low that, again, it's not sustainable and you feel either lethargic or deprived. Sometimes people want to gain weight, in particular muscle weight. We want to eat approximately 650 calories over your daily requirement to gain weight. And again, we're emphasizing muscle gain, which means you should be weight training and exercising as well. To get that additional calorie level in, it's really important to eat more often throughout the day and usually eat a meal before bedtime. Some suggestions would be eat more from all the food groups. Often people eat more protein thinking that will help facilitate muscle growth, but in actuality you need just a little bit more protein and more carbohydrates to facilitate energy for workouts. Add high-calorie nutritious beverages like fresh fruit or milk to snacks or before bedtime. Add healthy fats like avocados and nuts. Choose calorie-dense foods like trail mixes, dried fruit, real fruit roll-ups, or peanut butter sandwiches. The key to weight gain is similar to weight loss. What you do needs to be sustainable over time in order to gain the weight and then keep that weight on. Since we already mentioned that the changes that you need to make need to be sustainable, that should give you a real good clue about how to spot fad diets. Usually fad diets create a large amount of weight in a short period of time, and research shows that the quicker you lose the weight, the quicker you put it on. The last section that I'd like to cover is a bit on eating disorders. Eating disorders are basically an obsession with weight and an addiction to a type of abnormal eating behavior. And there are different types. Anorexia is the one that we are most familiar with. A person with anorexia usually has a low body weight that's abnormal and obviously low, an intense fear of gaining weight, and a distorted body image. In other words, they may appear to you as being very thin, but in their eyes, when they look in the mirror, they see an obese or a fat person. Generally, someone with anorexia severely restricts foods or eats very small quantities of certain foods. A person with anorexia also doesn't recognize the seriousness of their low body weight and the health-related effects. Bulimia can be defined as episodes of binge eating where a person eats a large amount of food in a short period of time, within about a 2-hour window, with a lack of control over that binge period. These binge eating episodes usually occur at least once a week for 3 months. Bulimics also usually do some type of compensatory behavior, such as induced vomiting or misuse of laxatives or excessive exercise, to try and remove the intake of foods. Bulimics are usually at or slightly above normal body weight. Treatment of eating disorders involves a full healthcare team approach. Often a person needs to be stabilized physically, and then there is a intense emphasis on the psychological aspect of eating disorders. Eating disorders that are caught early are more treatable. Eating disorders that continue on for more than a year are less treatable or take longer in treatment. In terms of prevention, I think that helping people see the beauty in their internal as well as their external behaviors are really important. We need to see positive things about ourselves regardless of our weight, and we need to learn to see food as nourishing and healthful. In the family unit, I think it's important to eat regularly and provide a good role model for that, and to limit comments about body image and provide positive eating role models and positive eating scenarios where you're eating for health and well-being, and talking about how our bodies are healthy in other ways besides our actual weight. There is more information about treatment and treatment centers that are local in your readings, as well as information on weight management apps that may help you if you would like to keep a journal or a record of your intake and your exercise.